My name is Tiffany Henry, and I'm going to be administering a complete bed bath, oral care, denture care, and change of the bed that is occupied. Before I've gone in the room, I have checked the patient's chart to make sure there is activity orders or no physician restrictions. I have done hand hygiene. I have also gathered all the equipment that I need. As I go into the room, I'm going to hang the bath in progress sign, pull this to ensure privacy, as well as turn up the temperature to make sure that the patient is warm and comfortable and does not get a chill. I am going to grab a set of gloves. And then I am going to set up the equipment that I need on the table. I am going to put a barrier towel down. And then I have the dentures. I have a cup, toothbrush, toothpaste, soap, tongue blade, and the moist mouth sponge, as well as the kidney tray. First thing I'm going to do is I am going to place the bath blanket. Actually, first thing I'm going to do is I'm going to take off the bedspread. And I'm going to make sure that it does not touch my scrubs. And I'm going to put it in the laundry basket. Then I'm going to put the bath blanket on. This will help keep the patient covered and warm during the bed bath. And when I came in, I did greet my patient. My patient was unconscious. I still explained what I was doing. If the patient wasn't unconscious, I would have asked the patient if they needed to use the restroom and if they had any questions. And since the patient is unconscious, I'm going to get an assistant to hold up the blanket while I pull out the soiled linens from underneath. I'm going to roll them into themselves. Again, making sure that they do not touch my uniform. And I'm going to put them in the laundry basket. At this point, I'm going to change my gloves. I am going to lower the bed to where it is at waist level. And I'm going to put down the guardrail. Removing the pillow from under the patient's head. I have filled my basin 2/3 full of warm water, 105 degrees temperature. I have tested it on the inside of my wrist to make sure that it is not too hot. I will get my rag and put it in there. And placing a towel underneath the patient's head so that we don't get water all over. Then I'm going to get my washcloth and I am going to wrap it in a mitt style. And we are going to start with the patient's eyes. Working from the inner canthus to the outer canthus. And the other side using a fresh corner from the inner canthus to the outer canthus. I am going to rinse with clean water and I'm going to come back with a new rag. Inner canthus to outer canthus, inner canthus to outer canthus. I am going to rinse my rag. I am going to come to the head and start from the forehead down the cheek to the chin. Using the other side, from the forehead down to the cheek to the chin. I am going to rinse. I'm going to come back and I'm going to go behind the ear, under the neck, to the bottom of the chin, and the same thing on the other side. And then I am going to pat my patient's face dry. Now I am going to undress my patient. And I'm going to pull the gown out, putting it in the dirty laundry. I'm going to take another towel and I'm going to place this across my patient's chest. This ensures the patient's modesty, keeping the patient covered. I am going to get a fresh towel and I am going to put soap on it this time, and we are going to wash the patient's chest. Lifting one side, I am going to make sure we go across, using the other, and then around the breast in circular motions. I would rinse, I would come back, and I'm going to lift the breast, and I'm going to wipe under the breast. At the same time, we're looking for any kind of skin breakdown or redness. I am going to get clean water, rinse, I'm gonna come back and I'm going to completely rinse the patient, and then I will pat dry. Changing out my water if it's dirty, making sure that the temperature is correct again. We're going to now do the abdomen. So I'm going to lift this up. I am going to get a clean washcloth. Again, putting it in the mitt. We are gonna start and come across, using clean portions each time. I would rinse my cloth, I would rinse the patient, and then I would pat dry. I'm gonna pull this back up as I pull the towel out. And we are gonna expose the arm. At this point, I have already done the farthest side of the patient and am now working to the nearest side. Supporting the elbow. I'm gonna place the towel underneath. I am going to get my clean cloth. I'm going to wrap it around. And we're gonna start holding the patient by the elbow to support. We're gonna go from distal to proximal in long strokes. This ensures venous return. And then I would rinse. I would come back and I'm going to get the axilla. I would get clean water on a clean rag. I would rinse the patient, and then I would pat dry, assuring that under the axilla is nice and dry. I would remove the towel, cover the patient's arm back up. Now if the towel is damp, I would get a new towel. And we're going to expose the patient's leg. Laying out a new fresh towel. I'm going to, again, support the patient by the joints. Getting a fresh cloth. Again, fresh water if it is dirty. We're going to soap, and we are going to start distal to proximal in long strokes. And I would rinse, I would pat dry, and then I would take my water. I'm gonna bend the patient's knee, put their foot in the basin, and I am going to proceed to clean the feet, cleaning between the toes. And then I would remove and I would rinse with my clean water basin, ensuring again that we dry in between each of the toes thoroughly and dry the patient's foot. I'm now going to remove the towel, and with assistance, I am going to clean the patient's back. So we are going to roll the patient. And while cleaning the back, again, I have clean towels. I have done a glove change. We're going to be assessing for any kind of breakdown on the skin while we're back here, any sores or redness. And I'm going to proceed in long strokes. I'm going to get a new cloth. I'm going to rinse, and I'm going to pat dry with the towel that I should have right here under my patient's back. We're then going to move down to do the buttocks. And I have a clean soapy towel. Gonna do the glutes. And then we are also gonna check to make sure if there's any fecal matter. We've cleaned that with toilet paper. And I'm looking for any kind of skin lesions, breakdowns, or redness. I'm gonna proceed with the cheeks apart, and we're going to wipe. And then I'm going to get clean water with a clean rag, and I'm gonna rinse the patient. And then we would dry. At this point, I would change my water and a clean towel if that one's damp. I'll the patient back. Thank you. And now I am going to turn the bath blanket into a diamond shape so that we can do perineal care. Making sure that we have the points down to the sides. One here and one at the patient's head. I am now going to bend the patient's knee, or the client's knee. We're going to take the corner and we're going to wrap it around, ensuring it goes around and it covers the foot. Doing the same thing to the other side. We're going to pull this back. I have donned new gloves. I have clean water and clean rags. We're going to go in from the farthest, and I'm going to go from the pubis symphysis down to the rectal area. And with the clean side, I'm going to bring closer in, pubis symphysis to the rectal area, and then down from the vulva to the rectal area. I would rinse, doing the same thing, farthest to closest. And again, I would have a towel here that would dry my patient. And once we finish with the perineal care, I'm going to move on to the oral care. And again, getting new gloves. I am now going to take a tongue blade, and we are going to put this inside the patient's mouth after we turn the head. This keeps the patient from the natural bite reflex. Also checking to make sure the patient has a gag reflex. We are going to start with mouthwash and a little bit of water. And we're going to take our swab and we're going to clean inside the buccal where the saliva collects. And then I would set this in a biohazard bag. I would get another one and I would do the top of the palate. I would throw that in a biohazard bag, get a fresh one. I am doing the tongue, the top of the tongue, the sides of the tongue, throwing this away, getting a new one in the biohazard bag. And I'm going to get a new blade, a new tongue blade. I am going to place it on the other side. And with a new sponge, I am going to do the inside of the buccal. Again, throwing in a biohazard bag. Drying the patient's mouth. I have done the bed bath and I have done the oral care. I am now going to change the linens on my patient's bed. So, with assistance, we are going to roll the patient to the side. And we are going to roll everything towards the middle. And then I'm going to get a fresh top sheet, or excuse me, a fresh fitted sheet. There we are. And we're going to pull these nice and snug, pushing towards the middle underneath the soiled sheets. We're ensuring that there are no wrinkles in any of the new linens, as this can cause skin breakdown and lesions. And I'm now going to get my draw sheet. And this is going to go under the patient. Again, pushing, rolling towards the middle underneath the soiled sheets. We would now let the patient know that as they come back over, they might feel a hump if they were conscious. And then I will switch sides with my assistant and proceed with the other side. Getting the handrail back up for safety. Sorry. And we're going to roll the patient again. Ensuring that the soiled sheets do not touch my scrubs. They're going into the laundry basket. And we're going to pull these nice and tight. And then rolling the patient back. I am now going to place a top sheet on my patient. And again, I will ask for my assistant's help to hold the top of the sheet while we pull the bath blanket out from underneath. Again, keeping away from the uniform and folding into itself. And going into the laundry basket. Thank you. At this point, I am going to put a gown, fresh clean gown, on my patient. Exposing the arm. And we would tie this around the neck. And now I will put the bedspread over my patient. Sure everything is nice and smooth. We are going to do mitered corners, and I would have placed that rail back up before I walked away from my patient to ensure that they don't roll out of bed. We're going to go underneath and pull this tight, lifting a corner. Tucking underneath. Same thing on the other side. We're going to lift. And at this point, I am now going to change the pillowcase. Turning the pillowcase inside out. I'm going to grab it by the corner so that it pulls over. Placing the pillow back under the patient's head with the open side away from the door. Throwing my gloves off, getting new gloves. I'm now going to take care of the patient's dentures. I would take a fresh towel, place it in the bottom of the basin so that we do not drop and break the dentures. These are going to be rinsed in a tepid water so that warm water will damage, so we don't want to do that. I am going to place a pea size of toothpaste, and I'm going to clean the dentures as you would teeth. The gums, inside, and I'm going to rinse with cool water so it does not damage. I have done the bottoms as well. If the patient was awake, I would ask the patient if they would prefer to have these in a glass of water or if they would like them put back in their mouth. I would now clean everything up, take all my linens out, take my equipment away, and I would do hand hygiene, and I'm done.